Well, now this second talk, or the second part of my talk, we are going to switch over to embryos a little bit, and so the idea is just to bring up then to the discussion the whole technology package. So in this talk, I'm just going to talk about what's going on with the technology and a little bit what I think is going to happen, and then I'm going to show you some practical results that we're working with. So again, embryo transfer technology has been around for many years. The first embryo transfer was reported in 1890 in Cambridge. So that means that it's not a new technology. It's a technology that's been around for many years. So then we looked at the reproductive biotechnologies. We are looking at artificial insemination. The first two talks were about artificial insemination. Then in the 70s, we got into in vivo embryo production. That was when all the continental breeds were imported in Canada and the US, and that started the commercial embryo transfer industry. And then in the 90s, we started producing embryos in vitro, and by now we are producing a lot more embryos in vitro. I think that we are just seeing the beginning of the in vitro embryo production around the world. We switched over in the late 90s when Dolly was born with the cloning and transgenesis, although I don't think that cloning is something that we want to do now. It's not an option. I don't think it's an option, and there's many reasons for that. But there's a new thing coming on, and I don't know if you're aware, which is called gene editing. Now you can edit your genes, and you can knock off some genes. For example, there's a project by a friend of mine in Uruguay that they took merino lambs, and you know that merino lambs, they don't look very good when they are born, and they knocked over one of the genes related to muscle development, and then they got double muscle merino lambs by doing that. So this is something that is coming around, and it's all ties along with genomics, which is the best way, I think, that we have now to select bulls as early as possible. So embryo transfer is being, pushed around, and now with genomics, we know if a heifer is going to be good or not when she's born, and we can also do genomics on the embryos. So we can take a biopsy of the embryos and know if that embryo is going to be good or not, and decide if we want to transfer that or not. And so we are just seeing the beginning of it. The only problem with genomics is that we need a lot of data. So now it's available for a few breeds because we need more data on all the other breeds, and it needs to be validated for all around the world. If we look at the picture about embryo transfer around the world, this is the traditional in vivo embryo produce, and this is data that we collect every year by the International Embryo Technology Society. George Perry is doing that. He's an Australian that has been helping us in collecting the data around the world. It's not something easy to do, that we try to get as much data as possible. But the last report, there were 632,000 and a bit over that of embryos that were produced in vivo. And the mean number of embryos produced, or transferable embryos produced, is 6.74. When we looked at the in vitro picture, it's about the same. This is the first report where in vivo and in vitro embryo production are about the same. When we looked at the embryos produced, we are looking at 600,066, and the mean is 5.96. So now we have about 50% of the embryos produced in the world are in vivo, and 50% of the embryos produced in the world are in vitro. And this is due to the advancement of the technology, and many of you know about it because they are available in Australia. Now, what are the differences between in vitro and in vivo embryo? Well, there are many things that we had to be aware when we start. One is that the frequency of collections. Usually, we can flush a cow every 35 to 60 days. We can push them a little bit earlier as well. We can flush them every 30 days, and we are going to get about 5 or 6 embryos per collection. With OPU and in vitro embryo production, we can do them every 2 weeks. So we can get more embryos if we are working with the right breed, and we are going to talk about what are the right breeds. It can be performed in pregnant heifers or cows up to 3 months. Over 3 months is hard because it's hard to get the ovaries to to take the oocytes out, and you can also do in prepubertal donors. And most of the IVF industry in the US is driven by prepubertal calves. They are trying to get oocytes from those heifers as early as possible, and some companies are getting embryos from heifers that are as old as 5 months, or as the earliest that they can get their hand in the rectum, and they can put the ultrasound machine, they are going to start getting embryos. They are not going to produce a lot of embryos, but they are producing embryos now from 5-month-old heifers with semen from 10, 11-month-old bulls. So this is going to increase the genetic gains dramatically because we are shortening our generation interval, which is the problem that we had all many years with cattle, which is not like pigs or like chicken, where the generation interval is so short that you can change around, and you know now we don't have breeds anymore. We don't have chickens, they all look the same, they're lines, and pigs are the same. Well, cattle will probably be the same in the near future. And the other possibilities that we have with in vitro is that we can produce successfully embryos using sex semen. We only need 1 straw to fertilize about 100 oocytes. We can also use sex semen with in vivo production, but we need 3 or 4 straws per donor. Now, nothing is for free, and there are some limitations to the use of in vitro embryo production. We need a high investment required. I have seen many, many farmers around the world that decided that they didn't want to pay to the IVF company for their services, and they decided to have their own IVF production. And I have seen that in Australia. Most of them nowadays, they are just collecting dust, okay? Or they went bankrupt, okay? Because it's a big investment and you had to recover that. When you produce embryos in vivo, the cow is your incubator. So if you want to go on a holiday, go to the Caribbean, you just let the cow go to the grass, and you don't have to worry about your incubators and setting up the whole equipment. You need to have a good production all year round to have to be efficient. So you need full-time, highly qualified personnel. That's a problem. And people have different things, and they want to take holidays, they want to do other things, and you have to worry about that as well. You need high numbers of embryos to pay the fixed cost. So you need a lot of donors. You need at least 3,000 transfers to pay the fixed cost. So you need to produce a lot of embryos in order to keep it going. And the other thing is that you have lower pregnancy rates with frozen thawed embryos. With in vitro fresh embryos, you can probably get the same pregnancies, but if you are freezing them, you still get lower pregnancy rates. There are some programs where you can get up to 50%, but if you look at the overall picture, it's about 35% what you get with frozen thawed embryos compared to 50% with in vivo embryos. And you're going to have more embryo-fetal losses as well. So these are the things that you had to bear in mind. Probably, if you're working with the right cows and the right breed, you can be efficient with both systems. But you have to know what are the advantages and disadvantages. With superovulation, we have come along through many years of research. We have now protocols that are pre-established, and this is one of the protocols that a lot of people use, which was developed during my PhD, where we found that we can use estradiol and progesterone to synchronize the follicle wave. So we use Qmate and estradiol, and then we start them on foltropin for 8 days. And now we have moved into inducing ovulation with GnRH, and we can also use fixed-time AI on the donor. So now we have a set program, which is 15 to 16 days, and by doing that, we can get about 5 or 6 embryos collected, and we can flush a cow every 35 days. So this is a system that you can work very well. If you look at breed differences, this is our own production. I just collected this data to show you here. So usually you get a lower number of embryos with Holsteins, about 4, 4.5, because they are lactating and they are harder to flush. But on the other breeds, you pretty much get, on average, 5 and 6 transferable embryos per collection. Now, when you look at in vitro embryo production, there's also some differences that you had to bear in mind. And one of the differences is that the Bos indicus type of cattle, they have more follicles. So you're going to get more oocytes out of a single aspiration. And this is also data from our lab, where we looked at Holsteins, Angus, and Bons Mara, so Bos Taurus breeds. There's a few Herefords here as well. Brangus and Braford and Brahman. And you can see there's a great difference between a Bos Indicus and a Bos Taurus animal in the number of oocytes you're going to collect and in the number of embryos you're going to collect. So basically, it works very well in Bos Indicus. You can make it work in Bos Taurus, but you had to select your own cows. Why I keep saying that you had to select the cows? Well, because there are big differences between cows. For many years, we thought that by manipulating the follicle waves, we can get a good number of embryos and we won't have any failures. And now we know that even by manipulating the follicle wave, we can get a big variation, as many as 0 to 30 embryos. So when you have a program and you flush 5 cows and you don't get any embryos, don't feel bad, because there's as many people as you around the world that could have a shitty day like that. Because if you have the bad cows, you're not going to get any embryos. If you just found the right cows, you can get as many as 100 embryos from 5 cows. And this happens every time you do it, because there's a tremendous variations between cows. And not all the cows are the same, even if they are from the same breed. Why? Because at the time of birth, cows have different follicle populations. And this is data that was generated originally from Ireland. And this is a Holstein herd in Ireland, the university herd at the University College of Dublin. And then they looked at follicle population. That means the number of follicles that you can count with the ultrasound machine. They were all Holstein. They were all managed the same. And when you looked at them, some cows have 60 to 65 follicles in their follicular wave. Some cows have 0 to 5 follicles in their follicular wave. So if you're going to superovulate this cow, she's going to give you a lot of embryos. If you're going to superovulate this, and probably you need a lower dose of FSH. If you're going to superovulate this girl, you're probably not going to get anything, even if you give them 3 vials of ultropin. With the in vitro embryo production, you're going to have the same difference. Okay? So this is data that was also collected in Ireland, where they looked at heifers that have less than 15 follicles, and they were superovulated with the same dosage of ultropin, and compared with heifers that have more than 25 follicles. And look at here, number of transferable embryos. Low follicle numbers, 3.8. High follicle numbers, 5.4. Okay? When this is set at the time of birth, it actually occurs within the first 110 days of gestation. So there's a genetic component, but also there's a nutrition component. If the cows are, if they have a nutritional stress in the first 110 days of gestation, their follicle population is going to be smaller. And you're not going to fix that in the cow's lifetime, okay? So you have to think about your cows when you get your recipients pregnant. This is what you have to think about. Now, looking at in vitro embryo production, this is data from Brazil, where they look at different breeds, Holsteins, Gyr, Nelore, and Senepol. And again, you see there is a tremendous variation. Of course, on average, the Bos Indicus will have more follicles. So you could have some cows. There's records of cows that have produced as many as 450 oocytes in one single aspiration. But there are also cows that give you 5 oocytes. Okay, so the mean is higher in the Bos Indicus compared to the Bos Taurus, but you can also have Bos Taurus cows that will give you 40 or 50 oocytes on a single collection. Okay, so how you're going to pick those cows? Well, it's not very easy, but now we have some tools that we can try to use to predict that. One of the tools is to use an ultrasound machine. The only thing that you need to have a good ultrasound machine. You're not going to do it with any ultrasound machine. So you need to have an ultrasound machine that allows you to look at follicles that are 2 millimeters in diameter, at least 2 millimeters in diameter. So you need to count all those follicles. And then you also need to do it at the right time. So you need to do them at the beginning of the follicular wave. So there's 2 ways you can do it. You can treat the cows with estradiol and progesterone and then do a follicle count 4 days later. Or you can do it right after ovulation. So it means if she's in heat today, you can do her 24 or 30 hours later and do a follicle count. And in here you see that there's a tremendous variation. This is another herd in Canada. Look at there were cows that were more than 30 follicles and cows that were less than 30 follicles. And these cows were superovulated, and the number of embryos were significantly higher in those that have more than 30 compared to those that have less than 30 follicles. So this is one tool that you could use. The other alternative is a hormone called Anti-Mullerian Hormone. And this hormone is produced by the follicles, and it can be done by taking a blood sample anywhere in the estrocycle. So you don't need to have a synchronized animals. You can just take a blood sample, and then you can do an ELISA test. And the cows that have higher MAH, which is how we call the anti-Mullerian hormone, it's also very well correlated with the number of follicles that they are going to have. So if you select cows for high MAH values, probably you're going to get more embryos in these cows. This is data from Pietro Varuzelli in Brazil, where they looked at the correlation between MAH and in vitro embryo production. So here you have follicle population, number of viable oocytes, number of viable embryos. And you see there's a good correlation between MAH values and the number of embryos that you can get in an in vitro program. It is not correlated with the rate of good embryos you're going to have, but it's correlated with numbers. So then if you have a cow with high MAH, you're probably going to get more embryos. And it has also been looked at in superovulation. So this is what they did in Brazil in this experiment. They took the mean value, and they say, well, let's say we're going to get a group of heifers. We are going to superovulate them. So we take the MAH value, and then we are going to divide them in two groups. We took the mean, and then we are going to see how many embryos are produced by the cows and that are above the mean, and how many embryos are going to be produced by those that are below the mean. And they did it with Holsteins and Nelore. You can see that there's a big difference between Nelore and Holsteins because Nelore will have more follicles to start with, so that's why they have higher MH values. And when they compare the embryo production, this was by in vitro embryo production. Look at here, in the Holsteins, low MH, 1.2, high MH, 3. In the other breed, in the Nelore, blastocyst produced, low MH, 2.2, high MH, 7. And you're still paying the same amount of money to the people that are coming to produce embryos from you. So you're going to make a lot more money by selecting these animals and producing embryos for them as well. In superovulation, this is also an experiment that was done in the US by a Brazilian, but he was working in the US at that time, and he divided cows in those that have the lowest MAH, the intermediate MAH values, and the high MAH values. And here you can see that the ones that have the high MAH values, they also produce 7.2 transferable embryos. The cows that have the lowest MAH produce 3.1. Now, there's a big caveat to this. That doesn't mean that all the cows that have high MAH are going to produce a lot of embryos. Well, it depends on the semen that you use, on the uterus, if you're going to get fertilized or unfertilized embryos and all things like that. And also, you're going to have 50% of your cows that are in the middle, and then you're going to have to give them a try. But if you want to select only for the cows that are going to give you lots of embryos, you can probably use this as a tool. So in conclusion, this is very sensitive. In conclusion, donor selection by ultrasonography, the advantages are it's a cow side test, so it means you can do it right there. It's repeatable as long as you know what to do it. The disadvantage is that you need to synchronize follicle wave immersion, you need experienced operators, and good quality equipment. If you want to do MH, the advantage is that it's simple, it's objective, and can be done at any stage of the estrocycle. The disadvantage is that it's cost, because in the US, I think they charge about $50 to $60 to do MAH and ELISA on the cows, and you need to get a laboratory that is able to do that. So that's the other problem. If you have a laboratory nearby that you can send the blood samples, then you can do it. If you don't, then it becomes a little more complicated. The other thing is that it's easy to detect the extremes. So we can detect the very good and the very bad. But then we had to decide what we want to do with the other 50%. So this is the other thing that we had to work on. But with anything like that, you think you can make a decision. The other thing that we've been working for many, many years is on recipients. And by using the same protocols that we're using with fixed-time AI, we can also use fixed-time embryo transfer. So if you have recipients that you want to put embryos in, the easiest way is to do it at the beginning of the breeding season, so then you use your cow herd for recipients. This is what we are trying to promote, because if you have a recipient herd separate from your cow herd, then it becomes very complicated, and then don't know what to do with all these recipients that are around the farm. They never get pregnant, and you end up sending them all to slaughter. So the easiest way is to start in the breeding season. And when you start in the breeding season, you need to synchronize those cows as early as possible. So the ones that do not get pregnant to the embryo, then they get pregnant by the bull, or if you do a round of AI. So then you can use different synchronization programs like prostaglandin, progesterone devices with GnRH or estradiol. We prefer to use these programs because it allowed us to use a fixed-time embryo transfer. With prostaglandin, which is still being used many, many times for synchronizing recipients, you need to do estrus detection, so you need to have trained personnel that can do it. Usually, the submission rates are lower because they are not going to come in heat at the same time, so they are going to come in heat within a window period, which is 2 to 7 days after prostaglandin. So if you want to transfer all the embryos on a single day, you're going to call a lot of recipients because they are not at the right stage. And it only works if the cows have a CL. If they don't have a corpus luteum, it means that they are not cycling, you're not going to get them. So by doing fixed-time embryo transfer, you can do as many as possible. In here, we have 750 recipients, but they are not synchronized all together, of course, because you're not going to transfer them all. But you can do as many as you can. And basically, we are using two protocols. They are the two protocols that I just talked to you about in the first fixed-time AI talk. So except that instead of the cows getting inseminated in here 24 hours after estradiol, we wait 7 days, and then we do a scan. And those that have a CL, we put an embryo in. Or we use this prolonged proestrus protocol. So in here, we remove the Q-mate on day 6. We give GnRH on day 9. And then on day 16, we transfer the embryos. We are using more and more this protocol because it fits with the superovulation scheme. So we have a 16-day superovulation scheme, and we have a 16-day synchronization protocol. So you start the recipients and the donors at the same time. And with IVF, what we normally do is we do the follicle aspirations in here or the day earlier, so then we are transferring the embryos on day 16 or 17. So this is what we are doing mainly with our IVF programs. Advantages of fixed-time embryo transfer: avoids or limits estrus detection. It can be implemented in suckle cows, in dry cows, and heifers. So you can use all of them as recipients. We are promoting the use of suckle cows because they are the most fertile cows that you have in your herd. And then it's probably, they are not going to have calving problems as the heifers. So I just hate to use heifers as recipients because then we lose many calves at the time of calving, especially if they are IVF calves, that sometimes they are a little big. So then you have a lot of problems. So that's, we are more and more using cows and less heifers, trying not to use heifers anymore. It's especially useful for using cows, as I say in the commercial herd. It's simple to follow and implement because you just need to follow the treatment. You have to select them right, of course. They got to have a good body condition, and everything that is required for an AI is required for an embryo. We get high rates of recipients used, so the submission rate is very high. And we get the same conception rates that we get with estrus detection, with prostaglandin and estrus detection. So just to show you some pieces of information, this is data from Argentina, Brazil, and the US. Charles Looney from southern US in Texas. And by implementing the same protocol, we get about 85% of the recipients treated actually receive an embryo. So if we got 100 recipients, 85 are going to receive an embryo, okay, compared to 50% that you normally get, or 60% you normally get with prostaglandin. And you see that conception rates are quite good. These were frozen in vivo embryos. They were in vitro fresh embryos, and these are in vivo and in vitro embryos. And these were in vivo produced embryos. So you see we get about 50% pregnancy rate. And If you look at the number of recipients pregnant over those treated, it's about 45% that you get them pregnant. And these are our results with our IVF program. This was from last year. We get about 80% of the recipients receiving an embryo. Pregnancy rate, 45.6, a bit lower than what you get with in vivo embryos, at least in our hands. And then we get about 12% of embryo fetal losses, anywhere from 5 to 15%. This is what we normally do. With in vivo embryos, we get about less than that, about half that. And I'm just going to finish with some things that we've been using with embryo transfer. You know that embryo transfer for many years and still is just something that only stud breeders will think about. You know, commercial breeders will never think about because they say it's too complicated, it's too expensive. But now bulls are becoming very expensive. And to pick the best bulls, you're gonna be spending a lot of money, even in our part of the world. So now people are thinking about it. And the other problem that you have with bulls is when you take bulls from a tick clean area to a tick infested area, like what we have in the northern part of Argentina. So this is where we are. We are here in the center of Argentina, but we have ticks from here up to the north. So people that buying bulls in the southern part of Argentina and then they take them to the north, you know, as well as everybody knows that the bulls take time for them to adjust to the new environment. If they are not premiumized, then they get sick. If they get babesia or anaplasma, then they may lose the fertility for as long as 1 year or sometimes for their whole life. So then one of the things that we've been using with some commercial breeders and we've been trying to promote is to produce bulls adapted to the environment. By doing that, we are selecting the best cows and the best bulls with the best EBVs and everything, and we are producing embryos with them. And one of the things that we are doing a combination of in vivo and in vitro embryo production. So for superovulation, you need to set up the follicle way. One way that you could do is by giving estradiol or progesterone. The other way is just doing an OPU, because you're taking all the follicles, and by doing that, you're setting them up again. So we are doing an OPU, and we are starting on FSH 2 days later. I think that we need to start them on FSH 3 days later, because 2 days later is too early. But with those oocytes that we aspirate here, we put them in the in vitro lab, and then 8 days later, we have IVP-produced embryos. And then we continue the superovulation program. If we do sex semen, we are going to AI the cows a bit later than what we usually do. We detect estrus and AI. If it's normal semen, conventional semen, the cows get AI at 12 and 24 hours. If it's sex semen, they get AI at 18 and 26 hours. And then we collect the embryos. So then we can have, within the same week, we can produce in vivo and in vitro embryos from the same donor. You're not going to do this forever, but you can do in a short period of time and get as many embryos as you can. And this is just 2 examples. This is a producer that wanted Brangus embryos, so we got male sex semen to produce this, and we produced 28 in vivo derived and 32 in vitro derived embryos from the same donors. There were, I don't remember how many donors, I think there were 5 donors, and by doing that, we produced 29 pregnancies. And this customer wanted to produce 25 bulls. So we produced 39 pregnancies. They're going to lose some, and some of them are going to be dads anyway, so you're going to end up, hopefully he will end up with 23, 24, 25 bulls 2 years down the road. And we did this with Bons Maras as well. That's for another client. We did 3 rounds of IVP and 3 rounds of in vivo produced embryos from 12 donors. We produced 312 embryos, and we got 40% pregnancy rate with in vitro produced fresh embryos, 47 with the frozen in vivo embryos. So we got 44.2% pregnant. So we got 138 pregnancies from this program. So this is something that now we can do, and you can just combine the 2 things. And the only thing that we are a little bit worried is how long you can do it. But if you do it in a short period of time, you can probably do it, and then you probably have to get your cow pregnant if you want. if you want to keep her. But that's one of the things that we still have. We haven't done this more than 3 rounds. So, but at least in a short period of time, you can get as many embryos as possible, and then you can use them in your program. And with that, I'll thank you very much for your attention. I think it's time for the last talk, and then we'll have the discussion.